Let me tell you something you might not hear from your doctor. It's a bit of a paradox, really, but it could be one of the most important things you ever learn about staying healthy, especially as you get older.
It's a pretty scary question, isn't it? But think about it for a second. You go in for a checkup, you feel totally fine, but then a few weeks later, you're trapped in this cycle of tests, anxiety, and procedures, and you feel so much worse than when you started. So what on earth is going on? Well, the answer is something called the Cascade effect, and it's exactly what it sounds like, a chain reaction that gets kicked off by one tiny, often completely harmless medical finding. You know, the best way to wrap your head around this is to picture your favorite sweater. You spot one tiny little loose thread. It's not bothering anything, it's not hurting anyone, but now you've seen it and you just can't unsee it. So you give that thread a little tug, just a little one, and suddenly, bam, the whole sleeve starts to unravel. In medicine, that loose thread, that's a harmless little nodule they find on a scan, and the tug, that's the just-to-be-safe biopsy, and the whole thing unraveling, well, that's a very real spiral of complications, infections, and surgeries that can absolutely wreck your quality of life, all because of something that was never, ever going to hurt you. So look, from an insider's perspective, the first and maybe the most critical rule for protecting your health is this: don't pull the thread. Okay, so we get the problem. Now let's put that sweater away. We're going to shift gears here. We're done talking about problems. From here on out, we are only talking about practical tools. These are the 4 smart swaps you can use to avoid that cascade from ever starting. First up, the whole body scan. Now the trap here is that these scans find every single tiny imperfection. They're called incidental lomas, basically harmless little wrinkles on the inside that do nothing but create panic. So instead of getting a picture of your whole body, do this, the Stair test. Can you walk up 2 flights of stairs without getting severely out of breath? That simple, real-world action is a way better predictor of your long-term health. And this right here just brilliantly sums up the whole philosophy we're talking about today. It's all about what your body can do. So yeah, just walk up the stairs. That is your scan. Smart swap number 2. Let's say you're feeling a little more forgetful, and the first suggestion is a brain MRI. The trap is an MRI is going to show some brain atrophy. That's often just a totally normal part of aging, but it looks terrifying on a report. So instead of the MRI, ask for the clock draw test. It's a simple pencil and paper task that's actually more accurate for diagnosing real cognitive problems. Third, instead of routine cardiac stress test, which by the way has a really high rate of false positives in seniors that can lead to some risky invasive procedures, think about the coronary calcium score. It's a non-invasive CAT scan that doesn't look for shadows or hints of problems. It literally measures the exact amount of calcified plaque in your arteries. It gives you a real number, not an ambiguous guess. Our final smart swap, instead of a routine screening colonoscopy after you turn 75, the much smarter approach is symptom surveillance. Why? Because after 75, the risk from the procedure itself actually doubles, and a lot of the cancers found at that age are so slow growing, they were unlikely to ever be a threat in your lifetime anyway. The swap is simple. Watch for key symptoms and focus on preventing problems with a good diet. All right, we've seen the problem, we've walked through the tools. Now here is your action plan. This is your refusal checklist, and I'm serious, this is the most important takeaway. Get ready to copy this down, or maybe just take a screenshot for your next doctor's visit. Let's go through it nice and clear. Number 1, say no to whole body scans. Ask for functional checks instead. Number 2, say no to those just checking MRIs. For forgetfulness, ask for cognitive testing. Number 3, say no to routine stress tests. Ask about a coronary calcium score. And number 4, say no to screening colonoscopies after age 75. Just practice symptom surveillance. All four of these swaps, this whole way of thinking, it can all be boiled down to one single really powerful rule. And that rule is this: test for function, not for pictures. This is the question ask yourself and to ask your doctor. What will this test tell us about what my body can actually do? When you focus on that question, on function, not flaws, that's how you avoid the cascade. That's how you protect not just your health, but your quality of life.